Coronavirus has been spreading throughout the world. Some countries have many cases, some have few. 3 countries, 3 prisons, and 1 virus. How do they compare? Almost all countries are on lockdown and most people are working from home. Prisons are one of the only institutions where people are still working full-time. Anna Maria visited Russia to find out how the Russian prisons dealt with this pandemic.
During coronavirus, Russian government is asking people to self-isolate. But how are they handling this in prisons? All Russian prisons are now on quarantine, which means no visitors but lawyers are currently allowed. I'm standing next to Matroska Tishina, and here all the prisoners from Moscow who have COVID-19 are sent to be treated. But how are they treated? That's what I tried to find out. Firstly, I talked to Yulia, whose husband, Alexander Shastun, is serving his time in Matroska Tishina prison to understand what is happening behind bars.
Как только был объявлен карантин, передачи тут же во всех московских СИЗО, насколько я знаю, были закрыты, в Матросской Тишине точно. То есть есть такой магазин, их 2, которые функционируют, да, на территории Москвы, вот московским изолятором следственным, их можно использовать. То есть там можно купить фрукты, овощи и заказать доп. Питание. Ну, какие-то элементарные средства гигиенические. Конечно же, цены там абсолютно завышены. Товары там не очень хорошего качества. ФСИН-магазин он называется. Никаких передач нет.
Anyway, there is a substitute for care packages, but there are people with, for example, chronic diseases who used to receive meds from their visitors every week. Now it's on hold. But actually, Yulia managed to solve this, at least for her husband.
Ну вот пока у нас адвокат, там, я не знаю, там, кого можно было достучаться и докричаться, у нее там сказали, вот ладно, приходите в четверг, там есть какая-то там окошко, комнатка, в общем-то, у нее приняли. Не знаю, как у других заключенных это происходит, удается им это или нет.
To find out whether other prisoners actually managed to get medical help at all, I asked Marina Klushova. She was a prisoner herself, and now she's an activist and helps other prisoners.
Ну, пришли, ну, померили, да, вот температура. Ну, чего, антибиотиками натыркали, все. Ну, вот так, да, да, натыркают тебя антибиотиками, иди, вот.
А маски что-нибудь?
А что там холодно, и что там все-таки в этих камерах, ну, не те условия, в которых больной человек вообще может находиться. Температура 38, ничего, пройдет. Температурят многие. Просто температура. Там постоянно кто-то болеет, потому что, ну, как в детском саду, все соплями друг друга перемазали, да? Вот. Так же и в колониях. Там постоянно ослаблен иммунитет. Ну, не может быть, что... Я не хочу там утверждать, что это происходит, но что-то очень странное, да, все.
I was also wondering how Matroska Tishina is handling the COVID situation, given that there is a hospital with infected people there. Is the staff wearing masks? Are the prisoners tested? And how are infected inmates treated? Are there any precautions?
А никто не знает. Ну вот мы написали запрос, да, адвокатский. Мне пришла бумага, что терапия проводится, и антивирусная проводится, и препараты дают. Что дают, узнать невозможно, потому что, в принципе, в тюрьме никогда тебе не дадут в наших СИЗО таблетку в слюде. Ты ее не получишь. Тебе дадут горсточку. Что ты пьешь, ты не знаешь. Тебе, ну, может быть, скажут, что... Сейчас, насколько я знаю, сотрудники изоляторов заступают на смены по 2 недели. Вот 2 недели они там живут, не выходя, потом они выходят, 2 недели они на карантине. Ну, вот.
I was looking for any official information from the government on coronavirus and prisons. However, the only open data I could find is that there are only 240 confirmed cases among inmates, given that there is 1.5 million prisoners overall in Russia. Marina actually also finds many COVID-related things strange, especially the fact that there is lack of open information on prisoners and no help to the ones that just got released.
Очень странно, что везде мы слышим про одну администрацию. То есть начальник колонии, зам по бору, зам по тылу. И очень странно, что люди, которые перемещались везде, друг друга награждают, но ни про одного заключенного мы ничего толком, информации никакой нет. Момент такой, вот освобождаются ребята. Освобождаются ребята, и вот ко мне приехал парень, через неделю выяснилось, что там, где он останавливался, а там ковид оказался. Ну, в легкой форме, слава богу, и все это обошло всех. Они первые в группе риска. Они выходят и со своим иммунитетом, ослабленным организмом. Вот это, конечно, тоже вот, ну, как тема, как вопрос, который стоит.
While in Russia, no one knows for sure what's happening behind closed bars and if the prisoners are even being treated, I went to Denmark. Denmark has only had one case of coronavirus in the Danish prisons since the outbreak. I wanted to find out what measures the Danish prisons took to prevent the virus from spreading. Denmark is known for having one of the most liberal prison systems in the world, where the focus lays on rehabilitation more than it does on punishment. Prisoners are allowed to wear their own clothes and even cook their own meals. They are also allowed to have visits as often as once a week. With the coronavirus pandemic, many things changed in society and also in prison. Denmark had one of the lowest numbers of coronavirus cases in Europe. With a population of 5,806 millions, there were 12,344 cases, 11,242 recovered, and only 600 deaths. In an email, the prison service writes, "We have been in an extraordinary situation where it has been both more difficult to be employed and deployed. The measures we launched in March have carried us through the COVID-19 crisis without major problems, with illnesses among employees or inmates. Thus, only one inmate has been tested positive for COVID-19, and very few employees have been infected." To find out if the prisons had been on higher risk, I've talked to professor in immunology, Jan Pausgaard. Hvorfor er det, at man er meget mere forsigtig med fængslerne, altså når det kommer til corona, end eksempelvis plejehjem?
Jeg tror, at noget af begrænsningen med fængslerne, det er, at det er lukkede områder. Du får problemer, hvis du først får smitten inden for murene og holde folk adskilt, fordi de har jo en dom, de skal jo stadigvæk være lukket inde. Så du får problemer med at administrere, at nogle er syge, og nogle er ikke syge. Hvor placerer du dem, sådan så de alle sammen kan være der? Og alternativet, det er jo, at hvis de sidder i enkeltceller, at så kommer de jo for praktiske formål i 24 timers isolation. Og de sidder i fængsel, og de har nogle begrænsninger, men det giver jo nogle flere begrænsninger, hvis man er lukket inde nærmest 24 timer i døgnet.
Are the Danish prisons prepared if the virus once again reached the prisons? I've asked prison guard Henning Mørk.
Nej, jeg tror, at det kan gå rigtig galt, fordi udover at kan jeg sidde her og prale på kriminalforsorgens vegne, vi har været gode og dygtige, det har vi også, men vi har også været heldige. Vi har været heldige, fordi at der blev lukket ned, og man har isoleret. Det gør man ikke mere. Vi har været gode og dygtige i Danmark til at lukke ned, men hvis man når der nu er åbnet op, så har man risikoen for at få det her ind, og der kan jeg bare se på de beredskabsplaner, man har, at det er ikke godt nok. Man må ikke læne sig tilbage og tænke, at det her, det kan ikke ramme os.
In Denmark, there are two types of prisons, open prisons and closed prisons. The open prisons are for criminals with a sentence under 5 years. John Wilcott is an inmate in an open prison. He's out for the weekend and has agreed to talk to me.
Ja, hej.
Ja, hej. Du taler med Salma Abdurrazag. Jeg er ved at lave sådan en dokumentar om danske fængsler, Og det er faktisk derfor, jeg gerne vil lige stille nogle spørgsmål. Så hvordan føler du, at fængslet ændrede sig så fra før corona til nu?
Altså, det ændrede sig på den måde, at nu var jeg jo en af mange, som blandt andet var overlovsberettet, og i forlængelse af det, jamen så handler det jo om, at når du kan gå på udgang og ligesom får en føling med virkeligheden igen, og sin familie pårørende, nu har jeg selv en søn på 2,5 år, jamen så er det klart, at når du lige pludselig, når alt simpelthen bliver lukket ned, og de forholder sig til mødeberedskab, og bruger argumentet, at de følger de sundhedsfaglige vurderinger, hvilket ikke var helt sandhed. Man kunne have gjort nogle andre tiltag. Et af dem gik på, kunne man jo have lavet et afsnit, hvor de ressourcesvage, de så kunne være, så det ikke påvirkede resten af menneskene.
Fik du lov til at skype med din søn eller noget under...
Ja, det gjorde man, men det skulle så være med din telefon, så havde du sådan... Og det var først efter nafttid. Altså, der gik... var det næsten 2 måneder, før at de fik arrangeret det der telefonbesøg.
Ja, okay. Og var I isoleret meget så, eller befandt I jer, havde I noget social kontakt?
Ja, det har vi jo så. Vi har vores telefoner på vores stuer, ikke? Ja. Det er så den sociale kontakt, vi har. Men det har man jo så også til daglig.
Tak skal du have. Hej. John is now going to pick up his son from kindergarten and then has to go back to prison. Talking to him made me realize that no prison is glamorous. The pandemic have had a big impact even in the most liberal prisons in the world. And as long as the virus is still here, the number of cases in the Danish prisons may rise. Mary has been investigating the prisons in the UK. They have appeared to be very overcrowded, and there was supposed to be a relief scheme to help manage the population in prison. But it has seemed to be disappeared. The coronavirus cases in prisons are still rising, and is the UK government really taking this seriously?
As British people were ordered to stay at home in March, prisoners were locked down too. All additional services inside prisons and youth offending institutions were shut down. The government has advised social distancing of up to 2 metres, wearing masks and other measures to stop the spread of the virus. But in the confined, narrow corridors of prisons, social distancing between staff and prisoners appeared to be an impossible challenge.
As you can see, no social distancing going on.
So what impact did the coronavirus have on Britain's prisons? I've been speaking to one prison officer who wished to remain anonymous about what it was like.
Social distancing isn't really possible, if I'm honest. They put in a few measures. Officers haven't been provided with PPE on an everyday basis. Once you go in the prison, you're sitting in tea rooms and briefing rooms with 20 people all crammed up.
There are currently 980 cases of coronavirus infections within prison staff and 503 within prisoners. And this number has been rising since the lockdown. The prison population before COVID-19 was already around 80,000 in England and Wales. Prisons were at 97% capacity at the start of the lockdown. So what did the government do to help prevent the spread? Guards are trying to keep their distance and are reducing the number of prisoners out of their cells at one time.
We're getting 30 at a time to exercise them. We're not rubbing them down, so we're not having that contact. Officers going around getting a few out for showers and their medication at a time. So there is a massive, sort of descaled regime.
Prisons had limited to no transfers at the start of lockdown, meaning there was little opportunity to create more space in prisons that were already overcrowded.
Because there's no transfers between prisons, we did hit the maximum we could take. We haven't had anything installed, no special measures or anything.
We have the highest prison population in Europe, certainly Western Europe. And this was a real opportunity for the government to take a brave step and look at, are there people in prison that actually need to be there and make use of the early release scheme and other mechanisms to significantly reduce capacity.
As of the 1st of May, 36% of prisoners were in shared cells.
There was a movement towards looking at which low-risk or non-violent prisoners might be suitable to release to better manage the risk associated with the virus and to effectively supervise them, for instance, under probation. As far as I'm aware, not as many as initially discussed have been released.
The government spent almost £4 million on 2,000 electronic tags to monitor prisoners. Originally, the government planned on releasing up to 4,000 prisoners. But latest figures reveal only 153 prisoners have been released. But why was this? The scheme did face major opposition from numerous Conservative MPs in early May. 6 prisoners were released by mistake under the coronavirus early release scheme. And since then, it seems no more prisoners have been released under this scheme. There was pressure to move the vulnerable population out of prison.
What we also know about the older population in prison is that quite a high proportion of those might be in for sexual offences, for instance. When we look at the numbers actually released, when the government estimated a few thousand would be released from prison to help manage the pressure on the prison estate and to keep people as safe as possible, it's very difficult to understand how so few have been released. We should think about the incarceration rate in the UK, and are there groups of prisoners and individual prisoners who may be safely managed elsewhere, reducing the risk to them, importantly also reducing the risk to staff, and potentially accessing services that will help reduce their risk of reoffending because they're in the community.
We still don't know for sure what's happening in the Russian prisons. Many suspect that the numbers are way higher. Denmark handled the situation very well, while in the UK, this pandemic uncovered many issues going on in the prison system. We can say for sure that these 3 countries handled this situation very differently. And we can also say that the prisons are no longer the same after this lockdown.